was really gory surgery. He had a guy that was taking out all the teeth and then doing implants and stuff, and there was blood everywhere. I stood up for 4 hours like each time. Absolutely loved it. I think he was trying to put me off and like, do you actually like this? But no, I absolutely love it. I really like the whole surgery side of dentistry, but I think that made me realize then, like, I'm not squeamish. I actually really enjoy this, and I was fascinated.
Welcome, guys, to another episode, and I'm excited to introduce Becca today. She runs the Instagram page BDS with Becca, and she'll be giving us an insight into life in Cardiff and being a dental student in Cardiff as well. So thank you, Becca, for coming on today. So Becca, I always start off with why you decided to go into dentistry. What made you decide on this as a career?
Okay, so for me, I know it's very cringy to say as a dental student, but I've literally always wanted to be a dentist. My parents are not medical or like dentistry at all. My dad's an accountant and my mum's a lawyer. So yeah, but I loved my dentist.
Well, that's perfect.
Yeah.
You've got your accounting sorted, and any litigation, you're covered.
Yeah. So yeah, I loved my dentist at home in Southport. Yeah, he was a lovely guy. I used to be so excited to go to the dentist as a kid, get my sticker, and I loved like brushing my teeth. I've never eaten sweets as well, because he said sweets were bad for your teeth. So yeah, I think since having him as a dentist, and I saw how happy he was in his career, I think that sort of resonated within me, even as like a 6-year-old me, that I wanted to like do what he does and be happy and like have a really good career in dentistry. But obviously, I didn't really know exactly if that was definitely for me until I started doing work experience and researching more into dentistry as I was like at the end of high school and doing my A-levels. But yeah, and then through work experience that I did, I realized that actually this is so cool. Like, I love this. I really want to be a dentist.
What was it about the work experience that really gave you that added passion for dentistry?
I think the best work experience I did was in Preston, actually, at a private practice. And the guy had been seeing my nana to do some implants. And she mentioned, like, oh, my granddaughter wants to do dentistry. So he said to her, he was like, is she sure? Like, bring her in. I'm going to show her the goriest things that I have and see then does she want to do dentistry. So I went in for like a week, and he was doing his like surgery. So he was doing like putting bovine into the bone so that there could be enough bone to do like implants and stuff. And it was really gory surgery. He had a guy that was taking out all the teeth and then doing implants and stuff, and there was blood everywhere. I stood up for 4 hours like each time. Absolutely loved it. I think he was trying to put me off and like, do you actually like this? But no, I absolutely love it. I really like the whole surgery side of dentistry, but I think that made me realize then, like, I'm not squeamish. I actually really enjoy this, and I was fascinated. So yeah.
What would you say were some difficulties in the application process? Did you face any?
I think the whole application process is quite stressful for like anyone going into anything like medicine, veterinary science and dentistry, because you have to start doing work experience so early, feel like you've got the hours. I think it just, the whole thing generally was quite stressful, but I really enjoyed, actually, I went to Runshaw College in Leyland, and they had a medical society, and they sort of helped us through the whole process, and that was really helpful. I really actually struggled writing my personal statement. I found that really difficult to do, to like express myself and be different, and in such few words. But yeah, so I think the whole thing was quite stressful, but it's so worth putting the effort in. And I think work experience as well really helps you to write your personal statement.
And in terms of the process of choosing dental schools, how did you approach that?
So I actually was so keen, obviously knew I wanted to do dentistry since I was 6 years old. I found a little personal profile that I did when I was in year 2, and it said dream career at the bottom. Everyone else in my class had put like astronaut, Olympian, like footballer, and I put like dentist. But yeah, for dental schools, I started visiting really early on. So I was at the end of high school, I went to Manchester dental school with my mum on an open day, which is so funny. I was so young, but my mum was like quite keen as well for me to go and see what it was like. So I went to Manchester really early, and then the second open day I went to was Cardiff, and fell in love with Cardiff like literally as soon as I went there. It was sort of like going to an open day. I think it's really important to see that you can like envision yourself being there and being happy, like studying as well as like the rest of like just living there. So yeah, I went to all of the open days really of the universities I applied to. I went to Cardiff, Newcastle, Leeds, and Liverpool open days. But yeah, as soon as I went to Cardiff, I was like hooked. I was like, I'm going to Cardiff. Like, I really want to.
What made you even have those as your universities of choice to visit? And even Cardiff, you know, why didn't you consider another university that might be within England?
Yeah, I don't know. I think I really liked the idea that Cardiff was the only dental school in Wales. And also, I really quite like Wales because I've been on holiday there with my family when I was younger. And I looked at the leaderboards actually for the year that I was applying. I think it was the students' leaderboard where they vote and then the universities get ranked, because I think student experience is so important when choosing a university. So yeah, I went to Cardiff because I think it was ranked #1 that year, like 2017, I think this was. So yeah, I went to visit Cardiff and I spoke to the students there. They seemed to love the course, and then I just loved the whole vibe of the city. Such a student city, like a small city, but there's so much there.
Yeah. So home for you is in the northwest. How far is it from home to actually getting to Cardiff?
It's a bit awkward, especially with trains. So if I go on the train, it's like 3 trains in 6.5 hours.
Wow.
Yeah, which is quite annoying, but yeah, worth it in my opinion. And then if you're in the car, it's about 3.5 hours, and the drive is actually really quite nice.
Yeah. What do you remember? What do you remember about the interviews?
So the interview, I think, I didn't enjoy the interviews. I had the MMI interviews at Liverpool, Leeds, and at Cardiff, and then a traditional interview in Newcastle. I'm not sure if they do traditional interviews there anymore, but I loved my Newcastle interview because it was just 2 people and I was just speaking to them, and it felt very comfortable. But I think MMI really pushed me out of my comfort zone, as it's supposed to. But yeah, had my first MMI experience at Cardiff. I thought I'd done awful. Because I felt like a lot of the stations were really like using your mind, and I kept thinking I've got like it all wrong. And I came out of the interview and I thought I hadn't got in, so I was gutted because I love Cardiff and I was like, I really want to go here, and I've ruined my chances. But yeah, by the grace of God, I got into Cardiff, so I was really happy.
Yes. Oh, congrats. I was going to ask, what would you tell yourself before you went through that interview process, if you could talk to yourself at that age?
Oh, I think I would just say not to put so much pressure on yourself, because I think all of us applying to dentistry, you put a lot of pressure on yourself to get in and like do really well all the time, like you're high achievers. But especially in an MMI setting, you don't need that extra pressure. Like you just got to go in with a clear head and just try your best at each station, and don't dwell on like the last station. If you've done badly, you just move on to the next thing. And yeah, just be yourself and come across as yourself, because they want to see that you're a well-rounded character. Yeah, and be nice to everyone on that day, like the people in the reception that like greet you. Just be pleasant to everyone, because you don't know if they're judging you like you are being judged as soon as you walk into the building. So
And in terms of the interviews, in terms of getting offers now, how did that process go for you? Did you find out early? Did it find out late? How did that go?
So because Cardiff was quite an early interview, I actually had my offer from Cardiff quite soon, and that was before my interviews at Leeds and Liverpool. So once I got my offer from Cardiff, I was like, oh, amazing. I was so excited. I remember I was walking across to the bus stop outside of my house to go to college, and I opened this email that I just got, and then I got in, and I ran across the road to tell my mum. I was like, Cardiff have accepted me, like I've got in. And the bus was coming down the road, and they were like, the other people at the bus stop were like, don't worry, we'll hold it for you. And yeah, I was absolutely ecstatic. So I got my offer from Cardiff and from Newcastle, and then I had interviews at Leeds and Liverpool, and I think part of me was like, oh, I've already got it.
Yeah.
So I still did go to those interviews, but I think I probably didn't try as hard as I would have if I hadn't got those offers.
Yeah.
So yeah, I didn't actually get offers from Leeds and Liverpool, but then on results day, I got a late offer from Liverpool, but I declined that anyway.
Okay. And what were the offers that you got? Were they 3As?
Oh yeah, they were all 3As for all of the dental schools, I think. Yeah, and then I ended up getting a star AA, so that was really good. Also, another thing that was really great about Cardiff in the application process was that you can have, if you drop a grade, so if you got A, B, and they couldn't take you on that year, they hold your place for a year, so you can reset your A level that you didn't get your A in, and then they've held that place for you. So you can, as long as you get the grade, then you can join the next year. So that was a nice little safety blanket, especially before like A level results day.
No, that's good. I didn't know that.
Yeah, I don't know if they still do that. I think they do. But yeah, that was really nice because I don't think many other dental schools did that.
Yeah, no, that's the first I've heard of something like
Yeah.
that before. How was the experience of now moving to Cardiff and getting used to Cardiff?
Oh, I love it. It is far away from home, but I really like it there. It's a really, really nice city. The people are so friendly. Yeah, and the people on my course as well. We're quite a small cohort. We have about 70 students, which is bigger than some unis, but quite a bit smaller than others. And so yeah, the whole vibe of being in dentistry in a small cohort and like moving into student accommodation with really friendly students, and the whole city just being very student friendly and like so much to do. It was really great, and I love it there. I think I'll probably stay there after I finish. But yeah, I love Cardiff. It has everything really. It's got the bay. I'm such a water baby. I used to be a competitive swimmer, so it's got its like competitive swimming pool at the bay, and it's got so many beaches as well. I surf, so
Right.
yeah, South Wales is beautiful. Yeah.
I'm trying to think. I think Llandudno is Llandudno the only place?
Yeah, that's North Wales. It's quite close to here actually, like Preston. But yeah, it's a lot further down.
So you said that your cohort's about 70. What's the cohort structure like from first year to third year and maybe even to final year? Because I know at the moment from third year into fourth year. Generally, what's the structure from start to finish?
So in first year at Cardiff, we have the main campus, which is basically right by the city centre. It's called like Park Place campus, and that has like most of the buildings, like the law building and yeah, basically all of the university buildings. So there's a biosciences building there called the Sir Martin Evans building. So in first year, we're mainly at the biosciences building 4 out of 5 days of the week. And you do all of biosciences. It has an anatomy centre, and we get to do dissection on cadavers, which is so cool. I know like not many unis get to do that anymore. We share them with the medical students. So I loved that first year, our anatomy like sessions. And you just do all of the biosciences modules basically in that first year, and then on Fridays we go to the hospital. So that's the other campus, the Heath Park campus. That's where the dental hospital and the main hospital is. It's where all the physios, medics, and dental students are, apart from the first year. But
in terms of getting around, is this using buses, walks? You know, how do people usually get around?
So the distance from the main university campus to that Heath Park campus is probably like a 40-minute walk. So it is quite far, but you can get buses. People will get Ubers if they lived like in the city centre of Cardiff in first year. But in my student accommodation is Taliban, which is where most students live. There's like over 1,000 students living there. It has 4 different sections, and I was in the north section of Taliban, and it was about 20-minute walk from there, so it's not too bad. Or some people drive if they live a bit further out. So yeah, it is displaced from the main university campus, but yeah, I feel like it's quite nice to be a bit more out of it, but still be able to like join in with the rest of the university.
I know I cut you off because you're telling us about the structure, but
Yeah.
is everyone coming from different places or even abroad, or are most people from Wales?
So there's a lot of people from Wales who will study in Wales because they get the course for like £3,000, I think,
Okay.
which is a third of the price as everyone else. So a lot of people on my course are from Wales. A lot of people speak Welsh, which I really didn't expect. One of my best friends that I've made, Welsh is her first language. That's crazy. It's about 12 people who speak Welsh on my course.
Wow.
And then everyone else is sort of from England. There's some students from Scotland. I think we have 2 in our year. And then there's, I think there's about 10 international students. So from Malaysia, Croatia, oh no, not Croatia, Cyprus, and yeah, some other countries abroad.
Wow, so quite mixed.
Yeah, it is really nice. I feel like because we're quite a small cohort, everyone knows everyone and everyone gets along really well. Yeah, it's really nice.
Okay. So yeah, how did things then progress from first year
Yeah,
to
so
final year?
so going from first year where you only have 1 day of like clinical experience, in first year we start to do impressions on each other and stuff and learn how to wash your hands, which is very important, especially at the moment. But yeah, going from first year to second year, the clinical experience definitely ups. You're at the dental hospital 5 days of the week. Now when you're having lectures, we do a module called oral ecosystems. So you're learning about tooth development and about caries and everything like that. So second year, a lot more clinical. You start seeing your first patient in about February, March time, after you've passed OSCE. So yeah, second year is really good. It's still quite a lot of lectures. We have all of our teaching didactically, with a few sort of like task-based learning, PBL style things thrown in as well. So yeah,
tell us a little bit about that, just because for some students who haven't been to university yet, they're not sure what PBL is.
Yeah. So PBL is like project-based learning, and it's where you get given like a case and then you do all your learning from that case, and you sort of do that alone and then or in a group, and then you'll come back and present that to your cohort. So I know some universities do all of their learning by PBL, which is quite cool, but I think for me I prefer the didactic teaching because then I feel like nothing gets missed out. You've got all the information given to you. But yeah, we do in second year have 2 task-based learning things. So for me, we had one on bone regeneration and coral used as like a skeleton for the bone grafts, and that was super cool. And and then other people had ones on like diabetes and how it's related to dentistry. And then also we have individual tasks scattered like throughout first and second year on different dental topics that we present in the form of a poster. So within Cardiff, you do have like those task-based learning, like PBL sort of situations, but most of your teaching is like didactic teaching in lectures or seminars.
You said in second year you do get some patient contact.
Yeah.
What does that involve?
So in second year, we start learning the clinical sides of dentistry. So we start off doing taking a history and exam is what I was looking for. Yeah, so we start learning how to do history and exam, and we start on the phantom heads and learning how to do fillings, which is super cool, and scale and polish. So we do all of the phantom head stuff, we have the lectures on it, and then by the time it gets to February, you've passed your OSCE, your first one on clinic, to make sure that you're competent. And then we start to see patients. The patient exposure in second year is much less than in the later years. So you see one patient like every 2 weeks, dependent on them showing up as well. Sometimes they will DNA, but I think that's at any university. So yeah, we start seeing patients from them, and obviously you have the full 3 hours to just take the history and exam. They give you so much time, but that's really good, I think, for building up confidence. And we also like practice on each other and stuff before. Yeah.
So what's that like in terms of, you know, you're saying you got that 3 hours. What are you doing for 3 hours with a patient? How does that work with the tutor?
Yeah.
Just give us a bit of an insight into that.
Yeah, so the first time I saw a patient, we're on the big clinics. So at Cardiff, there's the big dental school, and it has 3 floors, and there's all the different clinics, which are called dental education centres. So it's like DEC. You have DEC 1, 2, and 3. And when you start in second year, you're on the smallest one, DEC 3. And it's basically lots of units, which are quite open. And everyone's seeing a patient in different units, and you have at least like 2 or 3 supervisors in your clinical group. So there's like 1 supervisor to every 5 students doing treatment. So yeah, the first appointment I had, I was so nervous, but literally we just took history and exam. So went through the medical history of the patient. We were learning about how to build rapport with patients as well. So lots of little like small talk and conversation, and then just did an exam in their mouth. So charted the teeth and did a BPE. And that basically took up the whole 3 hours in the first session. But yeah, since then it got a bit faster. But yeah, it was really good to feel like you have the time and the support as well. Like the supervisors check every step of what you're doing. And they're definitely like watching over you, not left by yourself to do stuff.
How does the assessment work in terms of the clinics and even based? You said OSCE.
So
how does that work?
Yeah, so in first and second year, we have big written exams at the end of the year. And then obviously once you start your clinical teaching in second year, you'll have like the clinical exams. So an OSCE is where it's basically like MMI, but all clinical, and you just move around different stations, show how to do a scale and polish, like taking a history and exam of a patient, and all of those different steps, basically charting teeth, identifying which tooth is which. So we have to do an OSCE, and you have to pass that OSCE before you can start seeing patients in second year. And then other clinical type exams, you have your clinical competencies. So you have a competency on your scale and polish, on taking history and exam, and then later on, obviously, on endo and root canal treatment, and all the different treatments you can do on clinic. And then
almost that they test you to make sure that you're safe at doing something, and then
definitely. Also I forgot to say, on the phantom head clinic, so that's the plastic heads where you practice on plastic teeth. You practice everything before you do it on clinic, and then you have to pass a competency on those phantom heads before you can do treatment on patients. So we have a scale and polish competency and a fill-in competency in second year of dentistry, and then third year we had a crown competency, so I just had this year, and then next year we'll have a bridge prep competency. So
in terms of local anesthetic and injecting real life people, how was that in terms of practicing? Because I know some dental schools you do on each other.
Yeah, we did that.
So
that's in our second year as well. So in second year, we practiced doing local anaesthetic on each other. We had a whole 3-day symposium. So we had all of the lectures. We recapped anatomy for given LA. And then we went on to clinic for a session. And every 2 people had a supervisor watching them. But we partnered up, and then you had to inject local anaesthetic. We did a buccal infiltration, which is where you just do the gum around the tooth. And then ID block as well, which is the one at the back, to numb the whole bottom jaw. So that was a fun time. Thankfully, no one got trismus or anything from doing LA on each other, but yeah, we were all very numb afterwards.
Everyone came out of it healthy and safe.
Yeah. Oh yeah, definitely. And I think it's so important to practice on someone you feel more comfortable with, like on a friend or on a clinical partner first, before you're doing it on a patient, because it just definitely increases your confidence and makes you feel a lot less nervous about doing it on a patient.
And then third year,
Yeah.
how was
So
that?
yeah, so third year was really good. Obviously, we didn't get to have the end of third year because of coronavirus. But yeah, so third year, you still have quite a lot of lectures. So a lot of teaching is quite heavy in the first term. So this year we had human diseases teaching, which we also had in second year, which is basically going through all of the systems in the body, like cardiovascular system, the we did a bit of neuroscience, basically everything, like hormonal things. And yeah, you have a big exam in that at the end of the year. We also had, I do know, peds and ortho teaching, so pediatric dentistry, orthodontics, that we get tested on at the end of the year. We had restorative, so that's like more things on fillings and on crowns, endodontic treatment, which you start on the phantom heads. And then the fourth exam was on oral surgery and oral medicine. So all of those things which are taken from first, second and third year really teaching, you're examined on at the end of the year. So you get your intermediate BDS qualification. So yeah, quite heavy with teaching, but also heavy with clinical things. So we started learning endodontics.
So you said the intermediate BDS teaching. What do you mean by that?
So that's like the intermediate Bachelor of Dental Surgery qualification that you get in the middle of the course. Okay. So yeah, it makes up, I think, 25% or 20% of our whole degree. And I think as well, if people want to drop out of dentistry, they realise, oh, it's not for me after doing some more clinical things, they can come away with just a Bachelor of Dental Science after those 3 years. So yeah, it's like big exams. And it's important that you have to pass them to get through to the next year.
Do some people use that to do hygiene and therapy if they decided that they wanted to stop the degree there?
I think I'm not entirely sure. I never heard of anyone doing that actually, and I don't think there's been many people at Cardiff who have dropped out after the third year. So I'm not entirely sure about that. I'd have to have a look. But yeah, most people at Cardiff will carry on. I think everyone who does the course, there's very few dropouts in dentistry. But yeah.
I know you're not there yet, but fourth year and fifth year, what's the focus for those years?
So in fourth year, you have your advanced restorative, which is continuing with prosthodontics, so like bridge preps and more advanced prosthodontics, so more advanced dentures and everything. And then you have that bridge prep competency in fourth year, and then you also have more case reports to do. You start writing case reports on patients that you've seen in third year. But you continue to do those in fourth year. We don't have any written exams in fourth year, so it's very exciting, like at the end of the year, because we have done for the last 3 years. But yeah, more clinical, you're seeing a lot more patients. You go on outreach clinics to St David's, which is in Cardiff city centre, and to Mountain Ash, which is about a 40-minute ride away from the dental school. So
what are these outreach clinics for?
So those outreach clinics are to see patients who are in need of dentistry, so they come and see students to have it done for them, and you can be doing anything from fillings to root canal treatments. You have your own nurse. I think it's just to make you feel more comfortable in doing dentistry in a different setting than just the dental school. And then in fifth year you have finals exams in January. And then, so that's on all of the things that you've learned throughout your dental degree. You also start special care dentistry teaching. That's more in fourth and fifth year. But yeah, you have your finals exams in fifth year, and basically you have to get all your competencies to the correct number to graduate. And you're just seeing a lot more patients. You do you go on trips as well to Wrexham for 2 weeks to treat patients at a clinic there, and you can go to different hospitals on like a week to watch surgery there in like max fax units. So yeah, that's really cool in fifth year.
Is there a pressure to, meet certain requirements, like having done so many fillings or having done so many dentures, having done so many crowns or root canal treatments? Is there that pressure?
I think students definitely do feel pressure to make sure they have the numbers, but you actually have meetings every so often. I think it's like once or twice a term with the clinical teachers at Cardiff Dental School and the head of the clinical program to check your progress. So if you're falling behind, you've not done enough crowns on clinic, then they make sure that they can get you the patients to get your numbers up and make sure that you're competent before you graduate. So that's really good. So yeah, if you are falling behind ever, like the dental school are going to notice, and they will make sure that you catch up and that you're fit to graduate.
Okay. And so far, what would you say your experience of the dental school has been? What sort of experience can someone expect if they were to come to Cardiff?
So I love Cardiff. I love the dental school. It's so nice because it's like a little bubble of like Cardiff dentistry, and everyone knows everyone in the years. So there's always like friendly faces around, which is so nice. It doesn't feel as like daunting when you're going in to do your first root canal treatment. Really worried and like nervous, but then you like know everyone there, so, and they're all like rooting for you too and like supporting you. So I really like it. It's sort of like being back at school in a way, because it's like one building, you know, all the teachers, all the like academic staff, all the clinical staff. Yeah, it's got a really good vibe. I love the clinics. You have nice views of like the Brecon beacons from some of like the top clinics, and like from the library at the very top of the building. So yeah, I've loved it. Yeah.
I was having a look at one of your posts that you put up about the 3 things that you learned from your time so far. And I think, congrats actually on passing your 3rd year.
Thank you.
4th year. But yeah, just elaborate a bit more on what you were talking about there. And I know you were telling me before about the knee operations that you've had to
yeah.
So yeah, tell us a little bit about that.
Yeah, so for me, I know it's not like a dental experience shared by like many people, but every year I know there are dental students who go through situations in terms of their health. So for me, I've constantly dislocated my knee since I've been at university. Everyone at Cardiff knows I'm the girl who's always on crutches. So yeah, I actually had to take a leave of study from an interruption of study from February, but the dental school have been so supportive. I had a big knee op, and before they made sure that I was okay and that I was still okay to study. Like I even met with the current head of school, the past head of school. We've got a new head of school now, but she was so supportive and so lovely, and all of the staff were so nice. They bring me ice packs on the clinics, and the nurses as well really looked after me. So yeah, I felt so supported by the dental school, which is amazing to go through something like, because I was really stressed and I was really worried about the impact that it would have and if I'd have to take a year out. So yeah, I had my big knee surgery in February and I was supposed to go back 6 weeks later, but then coronavirus happened, so I haven't been back since. But yeah, managed to pass all my exams and revise from home. So yeah, they've been so good. And
how's really your knee now?
Not the best.
Okay.
I have to have more surgery actually on this Saturday coming up. But yeah, before I had another incident about a month ago, it was doing really good. So it's a bit annoying to be feeling like you're going backwards. But I know now that if I have any more surgery, that the dental school are definitely like there to support me. And as well, I really struggled with my mental health, and that was really difficult. I was taking a lot of painkillers for my knee because I suffered from chronic pain for about a year, which I feel like has actually been a really good thing to mean that I can be like have more empathy to patients who are in chronic dental pain, because I know what it feels like a bit now. I can relate to that experience. But the dental school was so supportive, like referred me to the university student support service, which is so good. And so throughout all of that, even though I was in a really like low place emotionally, I still felt like the dental school was a really positive place to go to, and they were all so nice.
Yeah,
Yeah.
that sounds it that you've had a lot of support there.
Yeah, because I
Right.
think sometimes you think that if you're going into a career or a course that's really demanding, you wouldn't have that same pastoral support. But I think my parents as well and myself, I was so like really um like content and like so happy with that experience and like quite surprised, but in a really positive way,
Yeah.
that they were so supportive. But yeah, it's amazing.
What final, if the dental students watching this, what advice would you give them about starting dental school and just about making the most of the experience?
So I think the biggest thing for me is getting involved. Like straight away, it's so scary, like moving to a new school where you don't really know anyone. But especially with a dental degree, you have to, and in the career of dentistry, you have to have a work-life balance. And I think it's so important to get out there, like out of your comfort zone, and join in as much as you can in first year. I went to all of the dental socials, even though I didn't really know anyone in first year. I always turned up, even if I was on crutches, and got to know all the older years. So you definitely feel more involved and included, and you recognise faces once you start to go to the dental school, to study there every day of the week in second year. Yeah, and I joined swimming society, I joined surf society. Yeah, I think even though it's very demanding, you have to make sure you're giving yourself time to do those other things to keep a good like work-life balance and make sure that you're happy.
Yeah.
Yeah, and make sure you go explore Cardiff or wherever, which city you're studying at, with your friends, and like make time for making friends, because those relationships and friendships are going to last like a long time after like your course. So
That's
yeah, it's a lot of studying, but you have to play hard as well, definitely. And yeah, I got involved with the BDSA as well, which I think is one of the best things that I've done.
yeah.
Yeah.
So tell us about that, getting involved with the BDSA, the BDA. Is it
Yeah.
BDA or?
Yeah, so you are a BDA rep, but the whole organisation is called the BDSA, so that's the British Dental Students Association, and so it's sort of a branch from the BDA, and it's where there's 2 reps from every uni, and you all meet together twice a year in the headquarters in London, on Wimpole Street. It's very fancy there, and yeah, you meet with the BDA to discuss issues within like dentistry, and going from your dentistry to your DFT, which is a training year, and it just sort of bridges the gap between like dental graduates and dental students. So yeah, that's really cool. And then we also organise events as the BDSA. So we have a sports day, we have a conference, and we have a new research summit actually. So the first one is in November of this year. So yeah, it's a really cool thing to be involved with. You get to meet so many people from other dental schools, and yeah, we all have that shared experience of being dental students, and it's so cool to bring all the dental students together with our events that we host.
It sounds like you've been getting very active, whether it was swimming
Yeah.
or the knee issues to the BDSA.
Yeah, not being so active since the knee issues, but I try.
What would you say dentistry is to you? If you were to define dentistry in one sentence, what would it be for Becca?
That's a good question. I think dentistry is a vocation. It's definitely, it's not just a career. It's something that you're going to be going into, that is like your everyday, you're seeing patients. It's not just a normal office job. It's something, yeah, it gives you so many opportunities, and it's that combination of science and that patient contact, like dealing with people. I think it's so cool. There's not many careers that are like that. And you're changing people's lives, you're changing their smiles, and yeah, I
Awesome.
think it's cool.
Awesome. So thank you for that. Guys, make sure to check Becca out at BDS with Becca. I'll put the
Yeah,
link
hopefully
down.
more posts will come soon once I'm starting back at uni.
We'll be looking forward to them. So yeah, no, guys, make sure to check her out. Make sure to subscribe to the YouTube channel to turn on those notifications, and we'll see you in the next video. Thank you, Becca.
Thank you.